Thank you for tuning in to another episode of Disrupt Health Tech. I am your host, Wendy Austin, and today we're going to talk about marketing your health tech business. I have Adam Rosenberg with me today, who is the Senior Director of Marketing at RXLightning. Let me introduce my guest, Adam. Adam Rosenberg is the Senior Director of Marketing at RXLightning, a health tech company who is streamlining and digitizing the specialty medication enrollment process. In his role, Adam focuses on partner growth, brand awareness, and sales enablement. By collaborating with commercial, product, operations, and leadership teams, he provides strategic guidance while delivering meaningful results. Welcome, Adam, to Disrupt Health Tech. Would you like to start with a quick overview of what RXLightning does?
Yeah, of course. First, thank you for having me. I'm really excited to be here. RXLightning is a newer company, only about 2 or 3 years old. And what we're focused on is improving the specialty medication enrollment and onboarding process. So, almost everyone in the country has taken a medication at some point in their life, but specialty medications are much more complex. You can't just go to the pharmacy and pick it up over the counter. There's a lot of requirements that the insurance companies need. In a lot of cases, these medications need to be infused, or you can't just pick them up and take them orally every single time. So there's a lot of steps to acquire this medication. A lot of that is paperwork that needs to be filled out. A lot of that could be confirming your insurance coverage or clearing a prior authorization. There could also be just signatures that need to be filled out. Or a lot of these specialty meds are hundreds or tens of thousands of dollars. So you need some sort of financial assistance, which is additional paperwork and additional applications. So what RXLightning has done is really digitize that entire process. We're an ecosystem. We offer an ecosystem of benefit check tools, prior authorization tools, financial assistance. We're connected to a number of different foundations and patient assistance programs directly from manufacturers. And all of that is digitized into one ecosystem. So when a provider is prescribing a medication, they can very easily collect the patient's signature. They can check for patient coverage. They can start the enrollment, not on a piece of paper that needs to be faxed in, but on a digital form that gets sent directly to the manufacturer. So digitizing that process really improves speed to therapy and adherence, and offers up a lot of affordability options as well.
Yeah. And just to give a sense for the audience what the specialty medications are, can you give some examples?
Yeah, our platform has over 1,200 specialty medications within the platform. So a provider can go to rxlightning.com, sign up to use the portal, and they can find digitized forms for 1,200 medications. Any specialty medication that you can think of is in there. The ones that come top of mind are a lot of cancer medication. Again, you can't just pick it up at the pharmacy. There's a lot of new radiopharmaceuticals that are coming out that we have enrollment forms for, and a lot of brand name medications that, again, are complex, need to be infused, are tens of thousands of dollars. They typically require enrollment directly from the manufacturer.
Would one of these examples be like medications that are going through clinical trials? Is that also included in that?
Not necessarily. Medications that are still in trial typically aren't able to be prescribed by a physician. So these are ones that are in the market and have been launched. And we work with a lot of manufacturers to get the most updated enrollment forms in the portal. And if we have a deeper partnership with that manufacturer, we're working with their hub or their support teams who can use our tool and see where the patient might be in that process. So have they started the enrollment form? Are we missing a signature here? Or do we need to confirm a prior or approve a prior authorization? So if we have that relationship with the manufacturer, they can actually access the information to help the patient through that process.
Okay. Well, thank you very much for sharing that. That gives us a bit of background of like what the company is that you're working for. However, let's get started with the marketing discussion. All right, so let's begin with health tech startups. And actually, I guess I forgot to ask: is RXLightning? Do you consider it a startup, or do you consider it, mature at this point?
Definitely a startup.
Okay.
So I started, I think I was around employee 30, which I definitely
Yeah.
consider startup. And now we're closer to 45, and I've only been there 3 months. So we're growing pretty rapidly. We're definitely still figuring out which pieces of our solution are marketable and which pieces of the solution we're commercializing. So definitely still early stage. There's market fit in a lot of different areas, and we're just trying to narrow that down and really figure out how to serve our partners best.
Okay. So, given that you're a startup, so let's start with the startups. In your opinion, what are the best methods for either, a health tech company or a med tech company to really market themselves? Like, where have you found, the best place to be?
Yeah. So across my career, I've moved from larger companies to smaller companies. I started
Right.
at a company with 3 to 4 thousand employees, went to a company that had 3 to 400 employees. Now I'm at a company with
Yeah.
30 to 40 employees.
Yeah.
So what I've seen is there are these general trends, like account-based marketing is
Yeah.
of the utmost importance to every marketer right now. How are you targeting the right accounts, getting your message to those accounts? I think for startups, you don't even need to think about account based marketing yet. You're not even
Yeah.
there. We need to figure out what our story is first
Right.
and how to get that story in the market. Not even the action of getting that story in the market quite yet. So, from my perspective, I think startups really need to focus on creating messaging playbooks or documentation that really can align the team and the company around who you are, what
Yeah.
you do, what your products are solving for, and figure out who you might need to be selling to. Like I
Yeah.
said, we're open to conversations with any sort of health system, manufacturer, hub. There's all these different audiences that we could focus on, but we are starting to figure out which ones are the best fit for us.
Yeah.
So once you figure out your individual story, your company story, what the challenges are that your personas are facing, and how your products can solve those, then you can move on to the fun stuff. You can go
Yeah.
to advertising and events and using intent data and all this other stuff. But I think starting with messaging, playbooks, and then building content off of that is really a great place to start.
Yeah. And I'll have to say, too, from my experience, I do a lot of work with startups, and I'll have to say, I totally agree with you about the brand messaging. And not just brand messaging, but sometimes just the brand itself. And, what is your mission statement? What are your values? Who is it that you're really trying to help here? I think a lot of those sometimes when I go into those situations, they have a idea about what they're wanting to do, but then they don't have that really solidified. And so I know I do a lot of market research and help them to kind of define what that message is. And I also have a couple of startups that they start with one approach. They have an idea about who they're going after. And then as we bring in people that they have conversations with, they actually change their product
Yeah.
because they realize maybe they're not in the right part of the market, or they're not offering a key piece that the market needs.
Yeah, and I think two things to comment off that. One, I think you need these kind of messaging and brand guidelines just so that everyone's beating to the same
Yeah.
drum.
Yeah.
Because if you have your sales reps out in the market selling one thing and your leadership team saying another,
Yeah.
and then everyone else saying something else, it's too confusing in the market.
Yeah.
But then, secondly, I think that you can really figure out um, what sorts of content and what sorts of strategies you can use based on the research that you're doing. And yes, you can definitely shift what products you're developing based on the research that you do. I mean, you could build a whole website based on engaging providers and making sure that providers are using the tool. But at the end of the day, and it might sound icky, but who's
Yeah.
paying? Like, who's paying? Are the providers paying for your solution? Are the manufacturers or the PBM? So you need to think about all these different things to really figure out who's a user, who's a payer, who's an influencer, and kind
Right.
of work through all the different personas.
Yeah, exactly. Yeah. So let me get to, startups with small budgets, right? Some of the campaigns that you feel are probably more appropriate, if you will, for a health tech startup with a small budget, and, whether that's sales, conferences, website, anything else.
Yeah. So I've run a number of campaigns, and RXLightning, like I said, we're fairly early stage. We raised our Series A round. The previous company I was at raised a Series C round, but still was an earlier stage startup. Um, and there are a ton of campaigns that can be run with no budget at all.
Yeah.
And I think like you don't need to throw a ton of technology and a ton of resources and a ton of expense into running effective marketing campaigns.
Right.
So I think starting with it does take time. Like I
Yeah.
didn't put time. Everything takes time, but it doesn't need to take a lot of money. I think the first and most important thing is if you have a small budget, spend time with your sales team and really understand what is or who is the key audience that you need to get in front of. Do they already have conversations set up with them? Are they already in our pipeline? Are they already clients? For a lot of startups, the startups that I've worked at, you get an initial core group of clients, and a lot of future revenue can come from those
Yeah.
clients. So figuring out kind of who is out there in the world is the most important thing, and then creating content for that next iterative sale. Is it a new product? Is it an upsell? Creating content, from my perspective, is free. Uh,
Yeah.
a lot of people do outsource content
Yeah.
creation, but if you're a small startup team, you probably are doing it yourself. So creating content, that could be PowerPoints, that could be one pagers or flyers, that could be long form content. A lot of people are using Canva or other
Yeah.
resources like that to build their own white papers. So I think building this robust content set is really important for any sales rep or any person on your company at your company who's going to be having those commercial conversations so that they can uh, drop that off, leave that behind. I was going to say the second thing that I think again you can do with very limited resources if you have someone with a skill set is your website.
Yeah.
Yes, you have to pay a couple $100 to WordPress or to whatever hosting site to make sure it's live, but building a website and getting it live is basically free. So you can create a lot of content, a lot of written content, a lot of visual content
Yeah.
just on your website. And now, again, there's a lot of time that needs to go into that to make sure you're creating blog posts and news articles that people will want to search for and that Google will rank for. But I've been in the Google search tool across the last couple of weeks, and I've done priority crawls on some of my new
Yeah.
blog posts. And you want to make sure that you're coming up on Google and organically,
Yeah.
and then building out your website. Now, Google Ads and kind of pushing yourself to the top of the ranking with ads is a paid expense. But I
Yeah.
think everything that we talk about, there's a free version and then a paid version.
Yeah.
The last one, the last two, I have two more. So we talked content, we talked website. I think PR, again,
Yeah.
can be paid, but earned media, making sure that you're working with your partners, working with your client teams to understand what stories you can tell in the market and then pushing that out. A lot of times I've pushed out stories our sales teams have pushed those out to
Yeah.
prospects or to potential clients and kind of rein them in because, hey, we went out and said we're partnering with this huge health system. Don't you want to learn more? There's a little
Right.
like the sense of FOMO. And I think that lastly, emphasizing the value of relationships and referrals and the investors that you have and other partnerships that you might have.
Yeah.
It doesn't take money to get an introduction to someone.
Yeah.
So if you have investors or if you have relationships in the market with either from a health tech background, tech companies that you might want to partner with, or people who work at health systems or wherever they are, there's probably someone that you know that can introduce you to someone. And again, I
Yeah.
think it takes time to figure out those relationships and help foster them. But that typically is a free sort of campaign that a startup with a smaller budget can run.
Yeah. And I totally agree. To counter to what you said about some of the free stuff. And obviously, if you have a really small budget, you're not hiring a marketing person. You're not hiring a marketing agent to do this for you. You're doing it. You're wearing a lot of hats,
Yeah.
including marketing. I think once you get to a certain stage, though, you start to recognize that you're getting too busy to do those functions yourself. And that's when startups tend to either go one of two directions. They'll either go for an agency like myself or hire in-house like yourself. And I'll just say from an agency perspective, oftentimes when I get involved, even though they're paying for my services, they're paying for like all of those services that you just mentioned. So it becomes a little bit cheaper, but at the same time, um, I'm often working directly with owners
Mhm.
that recognize that they're now getting too busy to do a lot of the free things that you've talked about, and or they just don't have the skill to do it. So we help them to work through all of those things that you'd mentioned as well.
Yeah, and I've worked with at companies of all sizes with agencies of all sizes,
Yeah,
and I think right now at RXLightning, I'm a one man show for marketing,
yeah,
kind of tackling things as they come and multitasking and reprioritizing. But I think there's a lot of opportunity to bring on an agency and say, okay, I'm really good at content creation
yeah,
and events. We need you, agency, to support with PR and scripting. Or
yeah,
like figure out what the entire scope is of what marketing needs to accomplish and then break it down and say, okay, I need the agency to focus on X, Y, and Z, whereas I am really good at A, B, and C.
yeah,
So,
yeah.
yeah, definitely agencies are super helpful if you need the support.
So going from like the small budget to maybe a little bit larger of a health tech organization, you talked about, your background being in larger companies of thousands of employees, and I certainly was at WebMD, thousands of employees as well. Little bit different, not so much an agency anymore, but when you get into a larger organization, a lot of times that marketing department is helping sales, both enabling them as well as making sure that the messaging is there, giving them collateral, that type of thing. Of course, we both know that there can be some miscommunication and or conflict between sales and marketing. So, how do you recommend for a larger organization how to kind of break down that barrier that you see between sales and marketing, or to help the communications between those two departments?
Yeah. First, I think one of the most important things is try to figure out what will help sales teams and really try to put your feet in their shoes. I was fortunate. I started my career in sales at the larger company that I was at, and I was on the phones all day, emailing prospects, building out pipelines, and really understanding the commercial process from start to finish.
Yeah,
So I think that really has given me a leg up because I can go into a conversation with sales reps and say, okay, I understand your funnel. I understand how you want to move things through the pipeline.
yeah,
So I think just really taking time on your own to understand what priorities the sales team has,
Yeah.
I think that makes a huge difference. And from the beginning, never set up any sort of boundary between the two. Don't
Yeah.
ever position anything as marketing wants to do this and sales wants to do this. Like,
Yeah.
you should be one cohesive team. I know some larger companies have different departments. You might have a marketing department and a sales department, but I really believe they should be rolled under one umbrella
Yeah.
because the collaboration between the two is so important.
Yeah.
Um, I think that something that I've really been focused on recently is kind of phasing out the idea of like marketing creates a lead and passes it to a
Yeah.
sales rep. I think there's no way around it. I think leads are important, and
Right.
if we have an inbound lead from our website or we host a webinar and there's 20 people who raise their hands, those are great leads, and I'm definitely going to pass them. But I
Yeah.
think at the end of the day, and I'll say it pretty bluntly, like, who cares who creates the lead? Like, I don't want credit for the leads from the website or from the webinar or whoever. Let's just celebrate that we have 20 leads,
Yeah.
and the sales team might create leads too. If they're at a conference, they might be having conversations creating leads, or they might be out on the road and having conversations. I don't think it matters who creates the lead as long as you're tracking those leads and then
Yeah.
creating opportunities. So why not just have the leads in your CRM, whether Salesforce or HubSpot or whatever CRM
Yeah.
you're using, and then together sales and marketing can figure out what the best approach is for each lead.
Yeah.
So is it a custom piece of content that you're sending? Is it a specific email or phone script? And then once it's an opportunity, again, sales and marketing can partner up. Are we
Yeah.
providing them with some sort of VIP experience? Are we using a custom pitch deck for them? Everything can be aligned, and I'd much rather marketing support sales in driving opportunities through the pipeline instead of creating 100 leads. Again, there's value in creating 100 leads, but there's much more value in getting 10 leads through the pipeline over the finish line.
Yeah.
So I think that's what I would say there.
Yeah, and that's in that case, there's really no barrier between
Yeah.
sales and marketing. What's interesting from an agency perspective is I see a lot of marketing agencies where they do the onboarding with a client, they get that information with the messaging, they get approval for the messaging, and then they only meet with the client once a month, right?
Mhm.
And then at that point, it really becomes the salespeople are like, hey, these leads are really bad. They're not qualified, that type of thing, right? What I do in my agency, we do a lot of sales enablement because we do a lot with health tech companies, which has their own special way of doing sales. But we meet with them weekly, twice a week, whatever it takes in order to really kind of understand their sales pipeline, like you said, and how they really want to be engaging with these clients. And we talk at a client or at a lead level sometimes to understand more about what they really need. So I really do feel like that helps to kind of get away from the, well, marketing's not giving us the right leads. And then marketing comes back and says, well, they had perfectly good leads. They just didn't follow up with them. It just goes back and forth, right?
Yeah.
So,
There's just so many. Again, having a sales background, I was in sales for a couple of years, and I think there's there's always this tension of, I want more leads, I want more leads. And
yeah,
then when you get leads, it's like, I don't want bad leads. I
yeah,
only want good. So it's like, okay, do you want more leads or do you want better leads? You can't
yeah,
always get both.
yeah,
But I think once you have a strong partnership with sales, then you can get to all the fun stuff. Like,
yeah,
okay, what are the accounts we're targeting? How do we want to target them? What sorts of personalization can we use? We haven't even gone into this, but I think like multi-channel account-based marketing is super interesting.
Yes.
Your
Yeah.
your audience might be only going to conferences, or they might only be reading
Yeah.
the news. Like, there's so many things you can do with sales once you have that strong
Yeah.
partnership.
Yeah. And so let's get into that a little bit because I do see that with the larger organizations that have a really good sales team, a lot of what we're doing is actually helping them when they're getting set up to go to the conferences, what happens during the conference, what happens after the conference, and so there's like certain events that we're helping them with, as well as I forgot what you said at the beginning, but oh, there was a term you used, not the account base, right before the account base. What'd you
Like
say again?
multi-channel.
Oh yeah, multi-channel. Yeah, yeah. So all of that, pulling all of that in, and having the sales people support that with imagery, case studies, all of that we can start to actually pull together and, you know, use in the appropriate channels. I see that being a real winner for some of these larger organizations that can support having multi-channel campaigns.
Yeah, I think almost every account that you ever want to target benefits from a multi-channel approach.
Yeah,
Um, some industries are really great about hosting amazing conferences with the right
yeah,
audiences,
yeah,
and
yeah,
some industries are not great about it. Healthcare specifically has literally hundreds of conferences, and you could go to 50 of them. You could go to a conference every week. There'd be a
yeah,
different audience, and you could really burn a budget really quickly.
yeah,
I do think conferences are really valuable because you can have 20 conversations in a day,
yeah,
and that can save a lot of budget. If you were going to have 20 of those conversations over the course of a year,
yeah,
it saves a lot of time and money. But I think you do need to be really strategic about which
yeah,
conferences you go to, and that's one, going back to the main point, like, that's a strong collaboration with sales, figuring out who the
right,
audiences are, what conferences you want to go to, and conferences are only valuable if you put in the prep work ahead of time. Like, if you don't
yeah,
know who you're going to target, you shouldn't even go to the
yeah.
conference.
Just curious, do you guys do conferences today at RX Lightning?
Yeah, we do a handful of conferences. Like I mentioned earlier in the conversation, we're fairly early as a company in terms of
Yeah,
what we're selling. So we aren't plastering our name across a conference saying we do X, Y, and Z, because we are still building some custom projects or
yeah,
solutions. And I think across the next couple of years, we'll really start to build out that presence. Now, we've
yeah,
been to the big ones. We've been to Health, and some of the other ones. I think Oliver Wyman was recently, and
yeah,
we've been to a lot of the Healthcare Advocate Summit is a good one. There's a lot of like medication access and people who are supporting the specialty medication space.
yeah,
What's it called? National Association of Specialty Pharmacy, NASP. We went to. So there are some really targeted ones that we've been going to, where we can have conversations with both clients and prospects. But we haven't done any where we're trying to get 1,000 leads from the
right.
entire
Okay.
industry. We're just not quite there yet.
Yeah, I was going to ask you the question of, how much time do you guys use to prep before you go to those conferences? But it sounds like you don't have a booth yet at those conferences.
So one or two conferences we'll have a booth at, because that's really how you get your foot in the door.
Yeah,
So we have a pretty basic booth set up with our brand and our messaging, and then we'll have some of our materials, some of our one pagers that our reps can speak to. But other than that, we attend conferences and start up as many conversations as we can. And then our leadership team has been presenting at a couple
oh, very
conferences.
good. Yeah, yeah,
Um, Presenting probably takes the most time out of
yeah,
anything. Just crafting the submission in a way that will actually get you on stage is incredibly time consuming. In the healthcare space, at least the conferences that I've been involved with, you really are only going to get on stage if you have a partner or the kind
yeah,
of end user who can
Yeah.
tell your story, they're not
The
accepting
KOL.
sponsorship
Yeah.
from a technology company. So
Yeah.
those can take a lot of time, especially with the number of conferences that are out there.
Just we do quite a bit with conferences as well, and helping them to put together all of that. There's a ton of marketing material that goes with you know presenting, being at a conference, all of that. So we help. I tend to tell people that they need about at least 4 to 5 months before they go to that conference to do a decent job. And if they want to do an outstanding job, it really needs to be about 6 months before that conference.
Yeah,
So,
and a lot of the submissions for presentations
yeah,
happen as soon as the conference
really early. Yeah,
ends. As soon as
yeah,
the year's conference ends, you're already submitting for the next year. So you
yeah,
really have
yeah,
to be thinking ahead for that. But also, if you want to design a new booth, many months
yeah,
prep time for that, the
yeah,
collateral, all of the things that go into it, you definitely need some time.
yeah, yeah. And you always have to there's always like the one or two things that happens right at the end that you're like, oh, we need to get this done quickly.
Yeah,
So it's all hands on deck.
yeah.
All right. So, is there anything that you'd like to end with today? We've kind of talked through a lot of different topics, but is there anything when you think about health tech companies, whether they're startups or, mid range or larger organizations?
Yeah, I think there's two things that have come up a lot more recently. Not only at RXLightning, but all the companies I've worked with across the last couple of years. One, healthcare is always evolving. So I think it's really important for health tech marketers to keep up to speed on
Yeah.
everything that's happening. And it doesn't mean you need to be an expert or have a doctorate in patient
Yeah.
care. Like, just I subscribe to probably 10 different newsletters, and I might pick one or two stories a day to really that I find interesting.
Yeah.
It helps you just stay up to date on all the appropriate terminology, see if there's any new legislation that's coming out. There
Yeah.
could be something just really interesting in the news. So I think just staying up to date with technology and healthcare is really important. I think on that note, something that marketers that has come up in a ton of conversations is this idea of generative AI and
Yes.
how
Yeah.
people are using it in marketing.
Yeah.
Um, my opinion is generative AI isn't taking our jobs.
Yeah.
I think it's helpful to as a starting point, but you're always going to need a true marketer who understands the business, understands the audience. Generative AI isn't good enough yet to create an entire perfect blog post or white
Yeah.
paper or social media copy. It always needs some sort of finessing, especially in healthcare marketing. So I think it's a great starting point. I think it helps improve productivity,
Yeah.
um, but it isn't taking our jobs, and it can just be one tool in your toolbox as
Yeah.
you're thinking about, especially for smaller startups. It can be a very helpful tool, but it's just one tool to be really successful.
Yeah. I totally agree. I subscribe, coming from a publisher background, obviously I have my own I have my own biases around the different publications and news outlets in the medical and health space to subscribe to. But yeah, my inbox is flooded with all the newsletters from all the different publishers. I totally agree with you on keeping up to date. In fact, I've provided guidance to some of my clients based on the fact that I have all of these newsletters. But it's interesting you brought up generative AI. I totally agree with you. In the healthcare marketing space, we obviously have been playing around with it a lot. What I find about it is that it's very it still gives you a lot more information than is really kind of necessary.
And sometimes a
And
lot of fluff too.
yeah, a lot of fluff. And, it's as a marketer, we're like, okay, we have a 255 carat limit. It's like, yeah, that's too much, right? And even if you tell it, I only need this amount, it still gives you too much. And then to your point, it gives a lot of fluff and not a lot of substance. And so we use it to brainstorm and help with um, not necessarily finding new things because sometimes it's a little outdated, but to really kind of ask the questions of, well, where do you think this is going? Or, that type of thing. We use it more as another market research tool.
Mm-hmm.
And then typically, it comes back with a whole bunch of information so that we have to go out and find out all of the different things that it talked about. But yeah, I find it's going to be interesting. I think a lot of people are thinking it's going to do a lot, but it's not quite there yet. And funny story, when I was working at WebMD, IBM Watson had just won the Jeopardy challenge to show that AI can be better than humans and all that kind of stuff. And they were trying to get into health. And that's when IBM Watson Health started. I read an article talking about publishers and everything, but I read an article where at the end of the article, the guy that was in charge of IBM Watson Health was like, healthcare is difficult.
Yeah.
Right? That was like his only statement. And so, I think healthcare marketing as such has so many barriers that you just can't go into any of the generative AI tools and just use it carte blanche. So.
Yeah, agree. Exciting to see where it's headed, but today I think there's a lot of hand-holding that needs to be done.
Yeah, exactly. All right. Well, thank you so much for your time today, Adam. And I really enjoyed discussing marketing for health tech organizations with you. Let me just get this going. And so if you want to have any more information about either Disrupt Health Tech or RXLightning, please see the links below. Thank you so much for attending today, and I'll see you next episode. Thanks for tuning in to Disrupt Health Tech. We hope you found our conversation today inspiring and informative. Remember, the key to success is using technology in an innovative way to improve healthcare experiences and patient outcomes. So keep a lookout for ways to challenge the status quo and keep innovating. See you next episode.